Hello and welcome to Tower Hamlets Talking Therapy's What Is series. This video will be looking at what is health anxiety. We will be covering what is health anxiety, common health anxiety symptoms, the vicious cycle of health anxiety, and how health anxiety is treated. What is health anxiety? Health anxiety is excessive worry about your health. You may overestimate the likelihood of having an actual and serious medical problem and underestimate your ability to cope with it or manage. Worries are persistent despite negative test results and/or reassurance from your health practitioner and family and friends. However, the worries can still cause really significant distress to you, and it affects between 3 and 5% of people. Common health anxiety symptoms. We are going to firstly start with looking at different thoughts or worries that people might experience. I worry that I may have or will develop a serious medical problem. I have difficulty concentrating on things other than my bodily sensations or symptoms. I worry that bodily sensations or changes are a sign of a serious medical problem. I worry that the illness I do have is worse than it is. I worry about my health despite my doctor's reassurance or negative test results. Health anxiety can also come with some unpleasant physical symptoms, such as a racing heart, feeling quite restless, having a tight chest, feeling quite sweaty and dizzy, having trouble breathing, and feeling quite clammy and hot. Someone with health anxiety may demonstrate the following behaviours. I physically check my body for symptoms and changes. I frequently visit health professionals to discuss my health concerns and symptoms or to have tests performed, or the opposite, so I avoid health professionals as I am too worried about my health and/or my test results. I avoid places or people or TV programs that may trigger my anxiety. I find it difficult to control or let go of my health worries. I search for information about my symptoms, either on the internet or in books. And I seek regular reassurance from my friends and family that I am healthy and well. The vicious cycle of health anxiety. We usually see that people with health anxiety have a heightened awareness of their physical sensations. So if they notice that their heart is beating slightly faster than usual, they may have some thoughts about them having a heart attack or that they're going to die. And understandably, that brings on feelings of panic. They may feel quite frightened and quite worried. And as a result of that, they may ask for reassurance from their friends or family. They may Google their symptoms or may even call an ambulance. And the more that they're focusing on those physical symptoms, that their heart is beating faster, they may notice that their heart beats faster and that they become quite hot and sweaty or have trouble breathing. And once again, that can feed back round into these thoughts that they're having a heart attack and that they're going to die. And as a result, they can become trapped in a bit of a vicious cycle. It is important to recognise that health anxiety can exist in people who are healthy, in people who experience real yet unexplained medical symptoms, and also in people who have an existing and diagnosed medical condition. However, whether or not you have real symptoms or an actual medical condition is not the main issue when it comes to health anxiety. The issue is how you are responding to and coping with these symptoms or conditions. If you respond to health issues or symptoms with excessive or persistent worrying, checking, reassurance seeking, or avoidance, then health anxiety may still be a problem for you. How is health anxiety treated? Research has shown that cognitive behavioural therapy, or CBT, is the most effective treatment for health anxiety. You will first learn how to identify any patterns and triggers related to your health anxiety. Then you will learn techniques to manage your symptoms. CBT targets your thoughts and behaviours. For example, you may look at being more comfortable and less anxious in situations that you would usually avoid. You may learn to reduce your checking or reassurance-seeking behaviours. You may learn how to reduce your heightened awareness of any physical changes. And you may also learn how to challenge the negative and distressing thoughts about being unwell.